Next, we have our esteemed expert panel with some of the leading startups and their CEOs presenting. The session is moderated by Jeff Rosowski from T-Mobile. Jeff is T-Mobile's healthcare industry advisor. The panel will present case studies, best practices, and ROIs in digital health.
Nice to be here. Thank you very much for allowing me to moderate this session on use cases, ROI, and best practices with AR/VR. We've got a wonderful panel here. I'm Jeff Rosowski. I am a healthcare practitioner, physician assistant by education training, had stints with IBM Watson Health, Boston Side, GSK, and now with T-Mobile. So for those of you who I've networked with earlier, it was nice to meet you. For those of you who I haven't, please reach out to me on LinkedIn. We do everything 5G related in the US. And so we're going to jump right into this because I have to keep a time check on my presenters here, about 2 minutes and 30 seconds apiece. So Danny, we're going to start with you. And just if you give an overview of how Precision OS is improving the health outcomes with patients and safety with the providers, that'd be great.
Yeah, so I was going to share some slides. So thank you, Jeff, and great to be here with everybody. So what we are is we're a collection of clinical orthopedic surgeons, simulation experts, and high-end game developers who have got together to create an experiential opportunity where physicians and learners can actually fail in a safe environment to help provide optimal patient care. Our current model is deficient in that type of learning, which we refer to as deliberate practice. So we don't really have a good mechanism by which we offer individuals an opportunity to fail, make decisions, provide data on their feedback, and then give them an opportunity to learn. And so with the collection that I just mentioned, we've created a fully experiential, immersive environment that is realistic and allows you to behave like you would in an actual operating room, because that really right now is our ideal model of learning, which is obviously suboptimal morally and ethically. And so changing that paradigm of education has been our focus for the last 3 years. And right now, our customers primarily are medical device industry who have a vested interest in teaching the safe and effective use of their medical devices to optimize outcomes, as well as residency training programs who are training the future of physicians for all of us globally. The value that VR brings, being on a mobile platform like the Quest is what we're using now, is it's portable education, so we can travel with it. It can be transported without the limitations of having people travel to courses, which is our current model. And because of this, we're currently active in over 22 countries and have been used in over 300 cities, even since the pandemic has started.
Wonderful.
So thank you.
Danny, thank you for that and being nice and succinct and quick on that. Graeme, we'll move over to you and over the pond, over the Atlantic. Let us know how big data and analytics is playing a role in AR and VR.
Great, thank you very much, Jeff. And hello, everybody. I'm Graeme Cox. I'm the CEO and co-founder of MTech Labs over here in the south coast of the UK. MTech Labs delivers the world's first medically certified biometric platform for collecting and measuring emotional and behavioral responses, which, amongst other things, enables the objective measurement of performance and response in virtual reality exposure therapies and training. It's configured as a simple plug-in mask for leading VR headsets and provides stress, emotional, and behavioral insights for both real-time consumption and action, together with offline data analysis, making it really a solution for leveraging emotional responses as a game input, if you like, and also an ideal platform for experimentation and experience testing. We provide a range of physiological data such as heart rate variability. We integrate pupillometry, facial movements and expression, EMG, IMU, etc. And our high-level machine learning insights provide emotional insights into the stress response and positivity or negativity of the wearer over time. I'm sure I don't need to stress to anybody in the audience today, this isn't a gimmick. Poor behaviors are a massive burden on health services as they contribute to most of the leading causes of death and disease in the world today. And these behaviors are fundamentally driven by emotional factors. Emotions drive our attitudes and influence our lifestyle choices, the food we eat, the exercise we take, the drugs we ingest. And it's long been understood that achieving significant and lasting changes to behavioral pattern requires a deep understanding of these emotional cues first and foremost. I firmly believe that we can only truly manage what we can first measure, and by quantifying stress response and emotional state as medical grade biomarkers of literally how we feel, we're providing critical data to support and drive programs that influence and improve behaviors for the better, from aiding talking therapies to monitoring and providing input to depressive states. I would love to tell you more about it, but in the interest of time, I will just say that today our platform is being used as an aid to virtual reality exposure therapies, covering phobias, anxieties, PTSD, and increasingly EMDR therapy in that, using digital biomarkers of emotional display, and it shows great promise as a wearable diagnostic for other conditions and symptoms as well. We're working on MHRA approvals for Class 2A medical device in the UK and the Netherlands, over here in Europe, but it's already been used as a straightforward medical device for supporting treatments in hospitals across the UK and in Germany, a growing number of private practices, and in clinical and psychological research in pretty much every continent in the world. Thank you very much.
Graeme, thank you so much. So from a behavioral health side of the coin, Sarah, what are some of the use cases in AR and VR as it relates to COVID and behavioral health?
So Helium, and it's spelled H-E-A-L-I-U-M. I'm not able to share my screen and show you video of this, but it is VR and AR worlds that are powered by your biometric data from your wearables. And it's for healthcare workers, for burnout. This is the stress Olympics right now, and not everyone has trained for it. So we're deploying Helium, H-E-A-L-I-U-M, to the front lines for nurses, physicians, in order to quickly downshift their nervous system. And it allows them to become more self-aware of their emotions, their brain patterns, and their heart rate. So anything that captures data, an Apple Watch, a BrainLink Lite EEG headband, you have the ability to quiet your mind and control these virtual worlds. It's a walk in the park for people who can't take a walk in the park. And we are finding that on those case studies, and as far as ROI, VR is the most therapeutic. Then the most therapeutic is VR with neurofeedback, then virtual reality, AR with neurofeedback, then augmented reality, then regular 2D media. So it's been fascinating for us in these published studies in Journal of Neuroregulation with the American Red Cross, as well as Frontiers in Psychology, how VR AR is having more of a therapeutic input than regular 2D media. So definitely a lot of RI in the XR-ceutical space, AR-ceuticals, VR-ceuticals, and we here at Helium are just hyper-focused on allowing people to discover that their thoughts have power to control things, not only in the virtual world, but the real world as well.
Awesome, Sarah. Thank you for that overview. And so from a provider, nurse, physician burnout perspective, Amy, what are you all doing to help improve patient and employee safety?
Well, CleanDocs is my company. I'm the CEO and co-founder of CleanDocs Technology, and we provide premium UVC smart tech hygiene. So we are designed to decontaminate VR and AR headsets, reduce the risk of shared contagions because we do it at a hospital level. All of our 60-second cycles are validated against a log 5 kill rate, which is 99% plus. We have actually kept some businesses alive during COVID, and we have been validated against COVID from hard and soft surfaces to multiple layers of an N95 mask. We eradicate viruses, bacteria, and fungi, and we provide all of that data to our clients to support them and their clients. And so what we've done to really help programs such as Sarah's and Danny's and work with a number of people who are here, who have fantastic applications in the use of XR, we support them by providing logistical solutions to safely do this. And I can tell you, even in healthcare, one case that I'm free to share is Hoag Hospital, for example, in Newport Beach, California. They were able to keep their VR program alive during COVID. They had over 600, just in the very beginning months of total lockdown here in the US, they were still able to treat over 600 patients in VR because they used CleanBox to help keep that program going. We've seen similar case studies in sports and entertainment, as well as enterprise. So that is how we will continue to support that. With our regular hygiene and smart tech hygiene, I just want to mention this because I think it's also really critical for businesses. Is all of our products will now include an RFID tagging component and data tracking for any kind of decontamination you do on any objects, whether, so with our new Omni, if you have, for example, cell phones in your healthcare center or tablets, lavalier mics, if you're in entertainment, and et cetera, you can actually, through RFID tagging, track the history, a hygiene history of any of those objects that you're using. So you can guarantee that you'll know exactly when they were last cleaned, if they completed the whole cycle, who used them last, and that type of data, which I think will be really important during COVID, but of course, post, reassuring businesses and their clients. Thanks,
Awesome,
Jeff.
awesome,
I'll
Amy.
put the website there.
Awesome, thank you so much, and yeah, glad to hear it's in Newport Beach, which is where I'm located. So as COVID alleviates itself, anyone who's here locally for a coffee or adult beverage, feel free to shoot me a note. David, what are some of the new use cases from a training perspective that you all are running into?
Yes, thanks, Jeff. Hello, everyone. So I'm David Trainor. I'm the CTO of Centurial. We're a UK-based company. We create immersive forms of medical and healthcare training. We partner that up with expertise in AI and machine learning. So personalized down to the individual level using some of the techniques perhaps that Sarah and Graeme spoke about earlier. I guess recently in terms of use cases, we've been involved a lot in creating new forms of VR-based training apps in the area of ophthalmology, particularly in trying to equip early stage college and university students who will be taking ophthalmology as a course to carry out basic pupillary examinations in a virtual environment on a virtual patient. So unfortunately, the other delegates here, we can't do screen share at the minute because I had some videos on this, but I'll describe the experience. Effectively, it allows ophthalmology students to conduct basic pupillary exams using a controllable pen torch and other objects to examine pupil response to different lighting conditions. We have a patient avatar that can be randomly programmed with currently 6 different eye conditions. So there's a diagnostic element to this experience as well. So the student carries out basic pupillary exam using a pen torch, and from the pupil response tries to deduce whether these are normal healthy eyes or whether there's some underlying condition. There's an assessment, ambient assessment part that goes on through this as well that checks not only the examination but other ancillary activities that the student has to carry out, hand sanitation, adjusting ambient lighting levels and so on. We go through that process and then at the end receive effectively an assessment of their both diagnostic performance but also how they've interacted with the patient. So that's we're currently rolling that out. We co-designed that with Dr. Michael Williams, who's a consultant ophthalmologist at some of our local health trusts here and also a lecturer at our local university. So he's provided all the medical domain knowledge to make sure that what we're producing is clinically accurate. And we're now embarking on, I suppose, an upgraded or more sophisticated version of that experience to actually be used on more advanced VR hardware in other clinical environments.
Wonderful, thank you, David. And wouldn't it be a conference call for me if my neighbor's dog wasn't barking at the top of the phone? Gauthier, yeah, last but not least, Gauthier, nursing education initiatives that you're working on out of Montreal.
Yes, well, hi, everyone. So thanks, Jeff. So my name is Gauthier. I'm the business director and co-founder of UBC. Yes, we are based in Montreal. We're a multidisciplinary team of simulation experts, nursing educators, and VR experts. UBC is the VR training platform for nursing, so we're specifically focusing on nursing. We help solving one of the most biggest pain points in nurses training by helping replacing the non-scalable capacity constrained simulation labs nursing students are going through. I mean, in general, what we've seen over the summer since the pandemic is that COVID has accelerated the adoption of VR. With pandemic, clinicals have been canceled. Students could not get the training they need. It was the same thing for traditional simulation labs, all on lockdown, just able to welcome very few students due to social distancing. Reset time were already difficult prior to pandemic, but have become a nightmare because obviously you need to sanitize the whole simulation lab before you welcome new students. So specifically for us, it's been, we've been working very hard on helping partner programs, and just above the summer, we've helped, students having access to 10,000 plus clinical hours so that they could graduate on time. And I think that was really the big problems for the nursing programs, specifically the ones we're working with in the US, in Canada, as well as back in Europe, is to provide actually the education and meaningful clinical experience that the students needed to graduate and help.
Wonderful. Thank you all very much. I believe we are at time, and I hope you all enjoy the rest of your sessions. And for the folks listening, please feel free to reach out to the panelists for any further questions you all may have.
Thank you,
Thanks,
Jeff.
everyone.
Thanks.
Thank you, everyone. Thanks, Jeff.